Welcome. This is an instructional video for nurses and practitioners to administer the timed up and go test. More than 1/3 of adults 65 and older fall each year in the United States. Among older adults, falls are the leading cause of injury deaths.
In 2005, 15,800 people 65 and older died from injuries related to unintentional falls.
About 1.8 million people 65 and older were treated in emergency departments for non-fatal injuries from falls, and more than 433,000 of these patients were hospitalized.
The risk of being seriously injured in a fall increases with age. In 2001, the rates of fall injuries for adults 85 and older were 4 to 5 times that of adults 65 to 74.
Patients often fall more than once. The average is 2.6 falls per person per year.
Women are 67% more likely than men to have a non-fatal fall injury. Rates of fall-related fractures among older adults are more than twice as high for women as for men.
About 1,800 older adults living in nursing homes die each year from fall-related injuries. As many as 3 of 4 nursing home residents fall each year. That's twice the rate of falls for older adults living in the community.
Muscle weakness and walking or gait problems are the most common causes of falls among nursing home residents. These problems account for about 24% of the falls in nursing homes.
Reduce hazards such as improving lighting, limiting wet floors, correcting bed heights, correctly fitting wheelchairs and walking aids, and correctly fitting attire. Environmental hazards in nursing homes cause 16 to 27% of falls among residents.
Everyone is at risk, and risk for falls increases as we age.
The Get Up and Go test is an assessment that should be conducted as part of a routine evaluation when dealing with older persons. Its purpose is to detect fallers and to identify those who need more evaluation.
The timed Get Up and Go has been shown to be reliable, valid, and practical.
From a sitting position, stand without using arms for support. Walk 10 feet, turn, and return to the chair. Sit back in the chair without using arms for support.
The equipment used are standard chair, stopwatch or watch with second hand, 3 meters walking space, and tape mark at the 3 meter mark.
Some tips for the timed up and go include the patient starts in a standard chair wearing his or her customary walking shoes and using his or her usual walking aid if needed. No physical assistance should be given. The patient starts with his or her back against the chair, his or her arms resting, and his or her walking aid at hand, again, if needed. Now we're going to do the timed Get Up and Go test, so I'll have you sit down in the chair. Perfect, stay up, there we go. The purpose of this test, I'm going to have you walk around to the green garbage bin, come all the way back, and sit down as fast as you can, and I'm going to time you. The time will end when your lower back hits the back of the chair. Are you ready? Yeah. Ready, set, go. Very good.
Patients whose performance exceeds the upper limit of reported confidence intervals can be considered to have worse than average performance.
In determining risk levels, if a patient is outside the high end of 95%, then they are considered at risk. If they are within or under 95%, they are not at risk. If the patient is outside of the 95% confidence interval, a follow-up assessment should be implemented.
Okay, so I'm going to ask you to sit down. There you go. Next, I'm going to have you stand without using your arms for support. So whenever you're ready. Very good. Now I'm going to have you close your eyes while remaining stationary. So now I'm going to have you stand with your eyes closed, and I'm going to push you gently on your sternum, and I want you to try to resist that and remain as stationary as possible. Okay, ready? So close your eyes. Okay, so now I'm going to have you walk a short distance and then just come to a stop. So at the line right up here. Okay, go ahead. And come to a stop. So next I'm going to have you turn around and then return to the chair, but don't sit down quite yet. Okay? Go ahead. Okay, and last I'm just going to have you sit back down in the chair without using your arms for support. Very good.
Here are some of the following questions that should be regarded following the assessment. Is a person steady and balanced when sitting upright? Is the person able to stand with arms folded? When standing, is a person steady in narrow stance? With eyes closed, does the person remain steady? When nudged, does person recover without difficulty? Does person start walking without hesitancy? When walking, does each foot clear the floor well? Is there step symmetry with steps equal length and regular? Does the person take continuous, regular steps? Does the person walk straight without a walking aid? Does the person stand with heels close together? Is the person able to sit safely and judge distance correctly? And lastly, is the person obviously fearful or anxious during the assessment?
There are numerous benefits of the Timed Up and Go test. The psychosocial component is a higher fear of falling scores equate with greater activity restriction. Studies reveal that the fear of falling is associated with external environment factors and in-home hazards prevent a barrier to physical function and physical activity levels of older adults.
Other benefits include knowing who's at risk and being able to implement proper interventions.
The Timed Up and Go test is correlated to Berger Balance Scale, clinical test of sensory interaction and balance, and multidirectional reach test. Being aware of older adults' risk of falls can be beneficial to nurses and practitioners in prescribing balance and strength improving exercise.
Thank you for joining us in this instructional video of the Timed Up and Go test. Hopefully it's beneficial to you in the future while performing clinical assessments.